Welcome to Nursing School.
Welcome to Nursing School.
Welcome to Nursing School.
Today we are going to study about drug administration and the right of drug administration and the right of drug administration. Drug administration refers to the process of delivering a pharmaceutical compound into the body to achieve a therapeutic effect. In the content of today we are going to focus form of drug and way drug will be administered and even right of drug administration and right of patient. We are going to define necessary terms that are needed in this content. Pharmacology can be defined as the study of substances that interact with living systems through chemical processes, especially by binding to regulatory molecules and activating or inhibiting normal body processes. Or pharmacology can be defined as the study of substances that interact with living systems through chemical processes. Processes. Toxicology is the branch of pharmacology that deals with the undesirable effects of chemicals on living systems, from individual cells to humans to complex ecosystems. Adverse drug event when an individual is harmed by a drug. Adverse effect an effect of a drug that is undesired. Side effect an effect of a drug that is undesired. Drugs are substances or compounds that prevent, treat, diagnose, or cure various conditions or diseases. Over-the-counter, OTC, drugs are available without a prescription to the public. They usually are safer than prescription products and are available for self-medication for various ailments. Principles of safe drug administration. Safety is a fundamental element in the process of medication administration. It is important to demonstrate good decision-making skills throughout the procedure. In the process of administering the drugs, nurse is using the 7 rights, which are as follows: 1 right client, 2 right medication, 3 right indication, 4 right dosage range and rate of administration, if appropriate, 5 right route, 6 right time, 7 right documentation, 8 monitoring for potential drug interactions, assessment of the therapeutic and adverse effects of the drug, education of the client and family, or caregivers, about the disease process, drugs prescribed, and therapeutic and adverse effects. Form of drugs and their route that are used to administer drugs. Enteral routes, drugs is placed into directly the gastrointestinal tract, oral per os, PO. Sublingual. Sublingual. Rectal, intrarectal EIR, suppositories. Parenteral routes. Intramuscular. Intravenous. Subcutaneous, SC. Intradermal. Inhalation. 3 topical applications. Local applications. Vaginal route, suppositories. Intranasal route. Transdermal route. Otic route. 1 oral per os, PO. Sites used for oral route, mouth indications and contraindications for oral route. Indications: medication is in a form that is safe for oral administration, for example, a pill or capsule. The patient is able to swallow the medication safely, for example, the patient doesn't have a condition that prevents them from swallowing safely. The medication is absorbed well through the gastrointestinal tract, for example, the medication is not destroyed by stomach acid. Contraindication: nausea and vomiting. In children who can be suffocated while swallowing a solid form of medicine. Unconscious and mindless. Inability to swallow following surgical intervention or paralysis. Gastric aspiration. Form of drug that are be used in oral. The forms of drugs that are typically used for oral administration are tablets, capsules, liquids, and powders. Tablets and capsules are solid forms of medication that are swallowed whole. Liquids are medications that are taken by mouth in liquid form, such as a syrup or elixir. Powders are medications that are mixed with water or other liquid and then swallowed. There are also some medications that are available in other forms, such as orally disintegrating tablets or films, which dissolve in the mouth. Advantages: 1. Safe. 2. Cheaper. 3. Painless. 4. Convenient. 5. Sterilization is not essential. 6. Self-administered. Disadvantages: 1. Not suitable for emergency as onset of action of orally administered drugs is slow. 2. It is not suitable for 3. Uncooperative/vomiting patient. 4. Unabsorbable drugs, e.g. aminoglycosides. 5. Drugs that are destroyed by digestive juices. Drugs with extensive first-pass metabolism, e.g. lignocaine. Lignocaine. Complication for oral routes. Gastrointestinal upset, such as nausea, vomiting, or diarrhea. Ingestion of the wrong medication, for example, if the medication is accidentally mixed up with another medication. Esophageal irritation or injury from the medication. Medication being absorbed too slowly or too quickly from the gastrointestinal tract. Delayed or decreased absorption of the medication due to food or other substances in the stomach. Inability to swallow the medication. Safety measures for oral route. Checking the patient's ID bracelet to make sure the correct patient is being given the medication. Checking the dosage of the medication to make sure it is the correct amount. Checking the expiration date of the medication to make sure it is not expired. Expired. Checking for any allergies or contraindications that the patient may have to the medication. Making sure the patient is able to swallow the medication safely. Making sure the patient is aware of the risks and benefits of the medication. B. Sublingual route. Sites used for sublingual route. Some drugs are taken as smaller tablets which are held in the mouth under the tongue. The absorption of a medicine occurs on mucous membrane when the tablet is placed under the tongue. That mode of administration is called sublingual. Indications and contraindications. Indications. The medication is absorbed quickly through the mucous membranes under the tongue. The medication is not likely to be destroyed by stomach acid. The medication is not likely to cause gastrointestinal upset. Contraindication. Indication. 1. The medication is not absorbed well through the mucous membranes under the tongue. 2. The medication is likely to be destroyed by stomach acid. 3. The medication is likely to cause gastrointestinal upset. Complication. 1. Respiratory complications. 2. Patient complication. 3. Availability in absorption. 4. Drug collection. 5. First pass metabolism. Incidents. 1. Choking, respiration, drug interventions and non-compliance with the medication. 2. Aspiration, when drug is swelling in respiratory tract. Precautions to be taken. A nurse should place the patient in a good position instead of using tablets. One should use syrup and suspension. The nurse should advise the patient on how he/she should take one drug instead of using two drugs. Also known as drug interaction is the intake of two drugs at the same time that are inhibit each other. 2. Parenteral routes. Parenteral refers to administration by injection, which takes the drug directly into the tissue fluid or blood without having to cross the enteral mucosa. There are subtypes of it. 1. Intradermal, ID injection into the dermis just under the dermis of the skin. 2. Subcutaneous, injection into tissues just below the dermis of the skin. 3. Intramuscular, IM injection into a muscle. 4. Intravenous, for injection into a vein. Intravenous, for site, lumen of vein, antecubital vein. Merit's drug reaches directly into the bloodstream, and effects are produced immediately. Immediately. A highly irritant drugs can be injected IV be employed even in unconscious/unco-operative/ vomiting patient. Demerits. Only aqueous solutions, not suspensions, because drug particles can cause embolism, are to be injected IV and there are no depot preparations for this route. Strict aseptic condition is needed. Expertises are needed. Painful risky thrombophlebitis of the injected vein and necrosis of adjoining tissues if extravasation occurs. Intramuscular, IM. Site, large skeletal muscles deltoid, triceps, gluteus maximus, rectus femoris. Merits. 1. Depot preparations, oily solutions, aqueous suspensions. 2. Can be injected by this route. Route. Demerits. 1. Perfect aseptic condition required. 2. Nerves damage. Subcutaneous, SC, site, subcutaneous tissue merits deport preparation is given demerits irritant drug cannot administrate example vaccine intradermal AL injection. The drug is injected into the skin. Example BCG vaccine, sensitivity testing. The complications. The complications associated with the parenteral administration of drugs include intramuscular administration, anatomical and procedural considerations, local muscle reaction, from mild inflammation to abscess formation, Clostridium necrosis, intrasynovial administration, post-injection synovitis, and lameness, and medication errors. Errors. Forms of drugs. 1. Liquids. The rectal route. The rectal route is a way of administering a drug through the rectum, which is the final part of the large intestine. The route can be used for both local and systemic effects, depending on the drug and the formulation. Site, rectum. Indications: when the oral route is not possible or desirable, such as in case of nausea, vomiting, unconsciousness, or diseases of the upper gastrointestinal tract. When the drug has an unpleasant taste or smell, which can make it difficult to swallow or tolerate. When the drug needs to act quickly and avoid the first pass metabolism in the liver, which can reduce its bioavailability. Contraindications: when the patient have diarrhea. We don't use the rectal route when patient have inflammation on rectum. Rectum. We don't use the rectal route when the patient refuse to use it. We don't use the rectal route when the patient have allergic to it. Forms of drugs that are used. 1. Suppository. Advantages. Useful for nausea and vomiting. Useful for gastric irritant drugs. Disadvantages: rectal inflammation inconvenient and embarrassing to patient. E.g. suppository. Inhalation is the way of delivering a drugs or other substances to the lungs and the bloodstream through the respiratory system. Sites: the nose, pharynx, larynx. Indications: treating or preventing respiratory diseases, such as asthma, COPD, cystic fibrosis, bronchitis, or sinusitis. Relieving pain, nausea, vomiting, or seizures, when oral or intravenous routes are not possible or effective. Enhancing athletic performance, by increasing oxygen delivery and reducing fatigue. Advantages: quick onset of action. Disadvantages: local irritation may cause increased respiratory secretions and bronchospasm. E.g. general anesthetics. Localroutes. These routes can only be used for localized lesions at accessible sites and for drugs whose systemic absorption from these sites are minimal or absent. The local routes are topical. This refers to external application of the drug to the surface for localized action. It is often more convenient as well as encouraging to the patient. Drugs can be efficiently delivered to the localizable signs on skin, or pharyngeal/nasal mucosa, eyes, ear canal, anal canal, or vagina in the form of lotion, ointment, cream, powder, rinse, paints, drops, spray. Thing to remember. You have remember and respect right of drug administration. 1. Right patient. 2. Right dose. 3. Right drugs. 4. Right time. 5. Right route. 6. Right documentation. 7. Right assessment. 8. Right indication. Nurse should remember the injection angle. If nurse is giving patient intramuscular injection, needle should be in 90-0. If nurse is giving patient intravenous injection, needle should be in 25-0. If nurse is giving patient subcutaneous injection, needle should be in 45-0. If nurse is giving patient intradermal injection, needle should be in 15-0. 0. Nurse always remember to protect himself and respect all infection control precaution as stepped by Center for Disease Prevention and Control. And always nurse remember 4 ethical principles: autonomy, justice, beneficence. Non-maleficence. 4 ethical rules: veracity, privacy, confidentiality, fidelity. Before administer drug, nurse should check the drug names, name of patient, name of drug and patient written in file if match with what patients say.